name is Dr. Walter Campbell. I'm a doctor of acupuncture and oriental medicine. I've been studying the vision problems for the last 12 years. My first patient was a Retinitis Pigmentosa patient, which opened the doors for me to what the healing mechanisms of the eye could be. In Retinitis Pigmentosa, retinitis is supposed to be inflammation of the retina, but for the most part there's no inflammation of the retina in Retinitis Pigmentosa. But the pigment does leach from the third layer of the retina forward through the other 7 layers to the top of the retina. And that's what your ophthalmologist is looking at when he looks at the top of the retina. He sees these purple splotches, and that's a pigment from the pigment layer, so they call it Retinitis Pigmentosa. Now, for the most part, most physicians consider that inherited as a genetic disease. I wonder about that. In some cases it may be, in some cases not, but for the most part, I have found that I believe that the Retinitis Pigmentosa, the inherited part, may be the fact that the blood system in the eye of a Retinitis Pigmentosa patient is different. And to give you an example, the arteries in the eye are different than any other part of the body. All the other part of the body has these spider webs called capillary beds that diffuse the nutrients and oxygen through the tissue, not in the eye. The eye has these like roller coaster arteries that connect directly to the vein. And these arteries have little microscopic holes in them that let the oxygen through and the nutrients through, but they're way too small to let the blood cells, they keep on going through and directly connect to the vein and out the eye. So it may be, I believe in Retinitis Pigmentosa, that those holes are smaller and therefore clog up easier, which could account for the fact that you have progressive, non-progressive, you have it stays dormant, it's just there. It doesn't get worse over time, and then all of a sudden, for some unknown reason, it gets worse and worse till we have blindness. Now, I think those holes clog up for the most part, not every case, but most part. And those clogs may come for what the Chinese call liver. There's an axiom in Chinese medicine that the eyes open from the liver. Now, the liver filters out metabolic waste. If it's not proficient in doing that, that extra metabolic waste could wind up in the eye and clog those little holes. Also, I think bad fat can clog up those little holes. That fat could come from trans fat, eating seed oils, margarines, anything like canola, corn oil especially, which is genetically modified, and it's hydrophilic. All that Bt toxin and glyphosate winds up in the oil. These things come together, and I believe clog those little holes. Now, those holes let through the nutrients, and those nutrients go directly into the pigment layer. Go into the pigment layer and nourish the pigment layer like a sponge. And your rods and cones, these are the nerves that do the actual seeing, sit in this sponge like your teeth are in your gums. And they get their nutrition only by diffusion. The nutrients and oxygen have to diffuse through the pigment layer into the rods and cones. No direct blood supply to these cells, like in your teeth. Your teeth has an individual arterial and vein that go in and out to keep the thing alive. Not so much in your eyes. The rods and cones are fed by diffusion through this pigment layer. That in Retinitis Pigmentosa, this pigment layer, it cannot be nourished enough and bleeds up through the 7 other layers of the retina. So why is that? I think it's because those parts of the retina are clogged up and are not nourished. The other thing is that the outside, if this is the eye, looking at it sideways, this is the clear part. This is the rest of the eye. This is called the sclera. This is the water balloon that holds your eye, all right, the outside. And then you have that vascular layer that I just talked about, then the pigment layer, okay? And then you have the neural layer, if you will, with the rods and cones. Now, most of the rods are on the outside, okay? And they're very sensitive. It depends who you read, 8, 10, 12, 20 times more sensitive than the center of the retina called the cones. And these rods get their nutrition from the pigment layer as well, but they are controlled by the next layer on top of the retina called bipolar cells. These bipolar cells regulate how strong when to fire and how strong the signal will be. Now in your central vision, you have one cone, one bipolar cell. In the rods, you have many rods connected to one bipolar cell, which makes the threshold more sensitive and controlled. Now what happens is, as the nutrition wanes for these rods on the outside of your retina, they begin to die off, or it depends who you read, they actually go dormant for a number of years, which we have revived a lot and brought the vision back, even though they were legally blind and have never had any night vision since childhood, and we've got it back. It's kind of interesting for that. But when one dies and they're all connected together, it kind of causes these other cells to go dormant because they're connected all by this bipolar cell. And what the mechanism is for that, this is pure theoretical. If there's any ophthalmologists on the audience, they're probably rolling on the ground laughing by now. But I think that's what's really going on. All right? And as they die off, you get this tunnel vision from RP, because all the rods on the sides, okay, are being turned off because A, they're not nourished, and then since they're all connected to one bipolar cell, or hundreds, depends who you read, 30 to hundreds are connected to one bipolar cell. This bipolar cell gets the signal that this one is dying off, and so he turns the others off. And this can spread very carefully, and you only get your central vision. And then it works its way into the cones. That's where the center vision occurs, and that's when they start losing all their vision. But normally the sides go out first. Now we've been able to bring back night vision. The first thing they notice is that they go outside and there's the sidewalk. They haven't seen a sidewalk since God knows when. And it's brighter and lighter. The lights become very bright, okay? And then, almost intolerably bright, and actually act as dimmer switches to dim down the rods, because they're much more sensitive than the cones in the daytime, so that that they don't overstimulate your visual cortex to quote unquote wash out the image. Now, if anybody in the audience remembers film had an exposure where the amount of light and the time exposed, there were certain limits for that film. And if you got too much light on a film, it just washed out the image. There's just this big splash of light and nothing else because you overexpose the film. I think that's what happens when the rods go out. Now, I had this one patient that for 8 years she could only see white. And this may be, in my opinion, and there's a lot of disagreement on this, but this may be this overexposure by the immigrant cells and the horizontal cells not being able to put the neurotransmitters into the rods, and they're overexposing the visual cortex in your brain, so you only see white. So as we treat and get those immigrant and horizontal cells on board, then we get some night vision back, and the bright lights aren't as bright, and then we work on the central vision. And we've been very successful at this with a number of retinitis pigmentosa patients. And we have some videos. If you go to youtube.com and plug in Dr. Walter Campbell, you can look at patients that were visually challenged, and we got most, if not all, their vision back. So we hope that you take a close look at us and think about coming in, let us treat you. Each patient is unique and different. Even though you have the label retinitis pigmentosa, it's a lot different in each patient, where it progressed, how it progressed, what's working, what's not working, what can be fixed. Now, we have an OCT eye scanner where we can see all what damage are in the 10 layers of the retina, and also look at the cornea in case that's been injured in some way. So we look forward to hearing from you. I'm Dr. Walter Campbell. We're in Lauderhill, Florida. If you wish to contact us, we're at 305-760-2414. Look forward to hearing from you. God bless. We'll see you soon.